Good morning, everybody. It's Dr. Galvin with a post-emergency department shift COVID update. Haven't done one of these in a while. Worked the overnight shift last night, so Monday night. Just finishing up. It's 6 in the morning now. I think we'll start with numbers, which we haven't run in quite a while. Worldwide, 12 million cases, 543,000 deaths, and here in the U.S., unfortunately, we've just crossed 3 million cases. Up almost 60,000 yesterday, 133,000 deaths, 1.3 million recoveries. In my state of North Carolina, we're up to 75,000 cases, about 1,438 deaths. Since I'm in North Carolina, I'm keeping a close eye on the numbers here, and we've been somewhat fortunate in that we have not had the massive spikes that some southern states have had. We've had big spikes, but not nearly what Florida and Texas and Arizona and other places have had. But as of yesterday, we had 982 people hospitalized, which is the highest we've ever had since this started. We've got a 9% case positivity rate in terms of testing, so that's not too bad. Some places are 20% positives. And our hospitals are not, running full according to the state. I think we're at 72% capacity. Now, remember, we are supposed to be at our lowest capacity in the summer. Where I'm at right now, we have one remaining COVID bed. We had one ICU bed, so we're full. And now we've got capacity, I think, to expand units that are perhaps not fully staffed and not fully operational right now, but we are pretty full where we should not be at this time of year, and a lot of it is related to COVID, unfortunately. Other interesting numbers from North Carolina, about 45% of the cases in North Carolina are between the ages of 25 and 49 years old. About 19% are between 50 and 64, and about 12% are greater than 65. So you can see a large number of cases here locally are among younger people. Now, testing, there's been some controversy about testing, and, we still get people commenting on YouTube that this is all a hoax. As a matter of fact, I was coming into work last night, and I stopped to get something to drink at a gas station here, and as I walk in, there's a gentleman expounding to everybody in the store that this is all a hoax and that we don't know what we're talking about, and he and I had a little bit of a discussion, and I said, you're welcome to come in and see for yourself, since it's a hoax, you don't need to use a mask, and he declined to come in. But, still people don't believe that this is true. I think as more and more people are coming down with it, I think more and more of us have got, personal friends that are suffering from it. We have someone that, a very close friend of ours is in Arizona. His mother is actually in the ICU with COVID right now. So it's near and dear to my family's heart. We have quite a few people that we know personally that have it. I've been asked a question several times about testing and how accurate is testing and things like that. Well, I think the testing for the viral test itself is better. I think we're around 80% sensitive or so, maybe even a little bit better on some of the tests. When to get tested, though, that's a great question. And, if I were to have COVID, for example, and I were next to you and I exposed you today, and you went out and got tested tomorrow, you'd be negative almost 100% of the time. That's because, that virus, you get exposed, it starts replicating and starts building up in your system. And we know that, early on, the viral load is low, and that's probably why people are not very infectious, probably initially when they get exposed. And then as time goes on, the viral load increases, the amount that you're giving off increases, and then the chance of you being positive increases. And so when would I recommend getting tested if you've been exposed? Probably 5 days to a week after exposure is probably reasonable. So what you do in the meantime, then you need to self-quarantine to prevent other people from getting it. Because unfortunately, if you test much earlier than that, it's very likely to be negative, although you still may have it. And that's one of the vagaries of the tests. Transmission is something we've been talking about a little bit. There was a number of scientists that have been urging the World Health Organization to look into aerosol spread. Now we've typically talked about droplet spread, and that's that sort of 6 feet distance where, I've got these virus particles and they're very, very small, but they get suspended in basically droplets of spittle and respiratory, moisture droplets, which are pretty big, and that's what the masks can kind of filter out and keep you from spreading. And the idea is that those particles are pretty big, they're fairly heavy, and they fall, and they tend to drop to the ground or to surfaces. When they land on surfaces, if they sort of dry there, they can form these fomites that you can potentially touch, and if you touch your face, you can get exposed, although we think that the transmission by fomites is relatively low. But aerosol spray is when you get these tiny virus particles that are suspended in much smaller droplets, and those droplets can float around in the air, and they can get caught in air currents. And there's been, some case reports, the big outbreak in the choir practice in Washington State. There was a case report of a restaurant spread of cases in a restaurant in China. That it was felt that it was possibly carried over via air conditioning, and we don't really know what how frequent that is, and so these scientists are urging that we need to do more research. We know it's certainly an issue in the hospital, and that's why we wear N95 masks, but we're oftentimes doing procedures like breathing treatments and other things where we can much more readily aerosolize these virus particles. So it's a little different in a healthcare setting, but there's some concern that there may be some airborne spread in the real world as well, and we may need to look at indoor exposures a little bit more closely. I wouldn't change behaviors based on that right now. Other thing I want to talk about, there's a lot going on, and I'm going to do a couple more COVID updates this week than I might normally do. I do want to talk about the Spanish antibody study, which isn't really the greatest news. Spain had a pretty big and pretty severe outbreak. They have done a large study. They tested 61,000 people throughout the country and did antibody testing to see, after we had this huge outbreak, what is the percentage of the population that has positive antibodies. Presumably these people may be immune, although we're not 100% sure about that. And what they found was only 5% had antibodies. We think we need to get to 60 to 70% to achieve herd immunity. Even in the big metro areas where they had very high concentrations of positive cases, the antibody positive rate was only about 8 or 9%, which tells us that it may not be possible to achieve, or ethical, to achieve herd immunity by just waiting for people to get sick. That we may do a lot of damage by doing that, and a vaccine may be the only way to really achieve herd immunity, because we just can't. It doesn't look like people aren't readily converting otherwise, and those data have been backed up. There's some studies from China, there's a study in Switzerland, there's been studies in the US that have shown that sort of 5 to 7% positive rate, which is far, far away from where we need to be. After 4 or 5 months of this, we're not even close to hitting 60-70%. So those are some things. So there's a lot of things. People have been sending me a lot of questions about. There's a guy who's claiming that he's got a cure for COVID for inhaled steroids, and there's a lot of reasons to not believe that. There was a hydroxychloroquine study out of Detroit that, again, observational study, lots of problems with that particular study, not randomly controlled. We'll probably talk about that later in the week. I'm going to probably do another Q&A sometime in the next week or two, so if you want to put questions below, we'll start collecting questions for a Q&A sometime in the next, either the end of this week or early next week. I'll get a couple other doctors on board, and we'll do a Q&A. I am trying to continue to try to keep people healthy. We are trying to continue to do some things based on health. We are in the midst and about to finish a series on weight loss, and the final installment of that is going to be about hormones and weight loss, and I'm going to probably post that on Wednesday. We did one last week on intermittent fasting. I think we've done a total of 4 or 5 of those weight loss videos, so if you're interested, go back and look at those. And if you can't find them, go to YouTube, because I think we have playlists set up there. It may be easier to find than on Facebook directly. As usual, wash your hands, take care of yourselves, take care of those around you, take care of your families. I'll be back, like I said, with more updates. I'm too tired to do much more today, but I will be back soon. subscribe to our YouTube channel if you would please, and also follow us on Facebook, and I will talk to you soon. Good night.